Hello, my name is Walter Milando, and this is my presentation on nicotine addiction. To start off, nicotine, it's a highly addictive compound. It's naturally found in the tobacco plant, and it's commonly delivered in cigarettes and vapes. What causes the addiction? Normally, it's triggers for the dopamine reward center in our brains. It creates pleasurable feelings and reinforces the urge to continue using the nicotine product, and eventually creates an addiction in like most individuals that use it. Here's the anatomy of nicotine addiction and what part of the anatomy that the nicotine does affect. It does affect the brain nucleus accumbens and the prefrontal cortex. It also affects the respiratory system, lungs, and bronchioles due to the method that's commonly used of inhaling, which is smoking and vaping. The cardiovascular system, heart and blood vessels, because it does constrict the blood vessels when you do take nicotine products. Tissues, neuronal and vascular tissues. Nicotine additionally primarily affects the brain's reward pathway, as I said before, which includes VTA, nucleus accumbens, and prefrontal cortex. The lungs and heart are also significantly impacted, just to summarize everything there. And the picture on the right does kind of go over how you have an increased cancer risk, which is commonly known by smoking cigarettes. It's been a commonly known thing, and it does increase chances for diabetes and pancreatic cancer and a lot of other diseases. For the physiology, nicotine, if it mimics acetylcholine, a hormone used for in letting muscles contract. Triggers dopamine and releases in the reward system and affects neurotransmitters, dopamine, and acetylcholine, respiratory and cardiovascular homeostasis, maintained mainly through hormonal regulation. Nicotine triggers that as well. Normal acetylcholine in a normal person binds to nicotinic receptors and regulates the dopamine. Nicotine mimics what the acetylcholine would do and overstimulates the brain's reward system. This disrupts the neurotransmitter, and it affects heart rate, breathing, and blood pressure. Nicotine is able to stimulate the release of neurotransmitters like dopamine, norepinephrine, and acetylcholine, leading to increased heart rate as well and alertness. And it has a way of activating the sympathetic nervous system as well. For the pathophysiology of nicotine addiction, nicotine downregulates natural dopamine production, as stated earlier. It causes dependence and withdrawal symptoms as well. It causes respiratory damage and cardiovascular stress, as stated before. And with repeated nicotine exposure, the brain adapts by reducing dopamine production and receptor sensitivity. This leads to a tolerance and dependence, as said earlier, when it binds to the acetylcholine receptors. It causes the brain to build a dependence. And during nicotine acetylcholine receptors in the central peripheral nervous system, where nicotine binds to produce its effects, the influx of calcium, sodium ions brought by this receptor activation causes neuronal depolarization and release of several neurotransmitters, including dopamine, which strengthens the reward-seeking behavior. Modulation of respiratory density. Furthermore, they moving forward, generally it does affect the adrenal medulla, raising blood pressure, heart rate, systemic physiological consequences, and addictive prosperity nicotine. So it does, in essence, it's a gateway drug. On the right, you can see a picture explaining how one becomes addicted to nicotine. Generally, it starts off by reinforcement, changes, and then the negative effect of the withdrawal, which leads the person back into smoking nicotine or vaping nicotine or using pouches. A diagnosis. This has been used for the diagnosis. I've been using the DSM criteria. Cotinine levels in blood urine can be used to diagnose people with nicotine addiction. Can also be based on a self-report basis, meaning that if you were to go see your doctor and they were to ask you if you do smoke, you could enlighten them on that. Nicotine dependence is diagnosed using clinical interviews, tools like the Fangstrom test, Cotinine test, used to confirm exposure. And nurses do play a big role in finding those patterns. For treatment, you normally use CBT and support groups. Nicotine patches have been a good way for people to use to get to break the habit. Bupropion, commonly known as Wellbutrin, is a antidepressant normally used to treat sexual dysfunctions or depression. But it also is a good inhibitor to disrupt the cravings of smoking. Varenicline, which is also another partial agonist for nicotine. And behavior interventions like cognitive behavioral therapy, along with like pharmacological options, like I said earlier, like bupropion, um, are ways nurses can educate patients to further get rid of this habit. For artificial intelligence on the topic, AI apps like Quit Genius, NLP tools like screening and predicting relapse are common like modern digital apps that people can use to prevent them from going back into these bad habits. They provide data-driven algorithms that allow people to keep themselves honest and not go back into the same habits they would otherwise. For demographics, high risk to get addicted to nicotine are teens, mental health patients, and lower socioeconomic groups. Um, Normally, people are marketed towards teenagers because they're more open to try new things, and it's a new market to get in a lifetime customer um, into the nicotine business. Um, in the US, 11.5 adult smokers, 11.5% of adult smokers, 11.5% of smokers are adults, and 14% of high schoolers use e-cigarettes. And globally, there's 1.1 billion users, which is about 1.9% of the population on the planet. And it's a prevalence towards male users. The mortality rate, there's almost about 500,000 deaths a year. In the US by itself, 8 million globally due to smoking. And racial ethnic groups, normally you find more smoking into Native Americans, Alaskan natives, um, Native men and women, and a higher percentage of smoking deaths due to heart disease, stroke, white men and women as well. Youth and mental health disorders and individuals in a lower socioeconomic background do tend to be pushed to smoking a little bit more than those who are not. And these are my references. Thank you for your time. Fuck.